My name is Usman, and this is my brief introduction first. Let's proceed from here. I did my pre-med through Cambridge University, and then I did my med school in Pakistan. And from there, I flew to United States of America and did my post-med stuff here. Still, uh, you know, language and learning are the two most important things that are always a continuous process. So I'm still in the post med, you can say, for the rest of my life. You can continue to learn. And I have experience in internal medicine, family medicine, ophthalmology, a lot of experience, ICU care, and oncology. I have been with ICU care a lot, especially during the COVID season with the patients who were on ventilators and things like that. So a lot of medical experience. You name a field, I would have experience in that. So, and currently I live in Michigan, United States of America. Beautiful state it is. I do recommend people to visit here, especially if you come to Michigan. Don't miss Mackinac Island. That's a beautiful place. So today I'm going to talk a little bit about migraine. It's a very important topic. So I wanted to create some awareness amongst the people about that. And here's a brief summary that I'm going to talk about, and then some references you can uh, Google through and get more knowledge and depth into that. So a very important aspect of migraine is your genetics. So if your mom has the migraine, you can get migraine, especially if you're a girl. And there are many other things. And important thing is aura. Aura is like a symptom that you get, or symptom or sign that you get before you actually start seeing the real headache. So people come to know. People do know. It's an awareness that tells you that, oh, the attack is coming soon. And so it's an inherited problem, not always, but pretty much. And from parents to the children, it's been uh, reported for quite a while. So, and then it's as you know, it's a problem with headache. It's a headache. So the big thing is how many people are affected? How common is it? 39 million people in the United States and 1 billion people in the rest of the world, in the worldwide, statistics, have been diagnosed with migraine. But us doctors, we say that it's still a small number. You know why? Because many people are undiagnosed migraine people. And that's the thing about it, that we don't know. There are so many people around us who have migraine, but they have never been diagnosed as such, like a labeled diagnosis. So that's another concern. We need to create the awareness. We need to create the awareness about the migraine and the symptoms and the signs and the aura and the treatment and prevention and prophylaxis and things like that. Who gets migraine? Women are top of the list. I'm sorry to say that, but yeah, huge number of the patients with the migraine that I have seen in my life and I still see have migraine. But that's not an absolute fact. If you are a male, you can also get the migraine. I am a male, but I do have migraine. So that's why I wanted other people to know about it. So, what can you do about it? Do you need medicine all the time, or do you not need the medicine all the time, or do you have some ways to prevent it? A very important thing in this regard is magnesium. Magnesium is available over the counter in the pills form, and according to the study in 2021, a very recent study, as you can see, 2021, it's as effective as this big drug that we give for migraine. So it's a huge accomplishment. So it's an over-the-counter pill, which is a mineral that you can take, and it's helpful. And this is like a dosage. And if you go to Walgreens here in America or CVS pharmacy and other places, you can easily find it over the counter, and it helps a lot. It helps a lot with this, so you can give it a try, and then send me a message in the comments, or you can email me, you can WhatsApp me. We can talk through and how was your experience about it. But as you know, no pill is free of side effects. There is no pill in the world that has no side effect. Just take it as a fact. So, uh, so if you have some problem like breathing problem, if you have problem with your heart, so if you have problem with your blood pressure, if you have problem with your history of a stroke or coma and things like that, Be very careful. You do not have to take it. Talk to your doctor. Talk to some solid healthcare provider. And especially at this high dose of 400 to 500, please do not take magnesium pills in that case. So be careful. Uh, Leave a comment in the comment section and talk. We will talk it through. So, what's the other way out? So if you find magnesium in the diet, so that could be a very good, that could be a very good boost, and that's not going to affect your heartbeat or blood pressure or breathing problems and things like that. So, how can you get magnesium? How can you get magnesium? There are several things. Almonds, are really good, and in America and in many parts of the world, you have almond milk also. So that could be a very good alternative. Bananas are my favorite. I love bananas. Dark chocolate, really good. I found out about dark chocolate. Like, my mom has migraine, and I found out that every time she has migraine, if she takes hot chocolate, she she gets a lot of relief. Why is that? That's the answer here. I found out the answer right here. It helps a lot. Avocado. Put these things into your diet. Take avocado. Like, it's one of the healthiest things that you can put in your diet. Avocado, my favorite. Put it in your, salad or something like that. Very healthy. So tuna, and fish and mackerel, pollock fish, and things like that. Lots of pumpkin seeds and squash seeds and soy milk. They are very, very healthy and very beneficial for the migraine people. And there are many other remedies, like, don't let yourself dehydrate, because if you're gonna get dehydrated, you're gonna have decreased minerals, and magnesium is one of the very important minerals. If you are a sportsman or athlete and you're not hydrating yourself, you will have a lot of problems with your muscles and the bones, and you will end up having headaches. Why? Because you are going deficient in your magnesium and other very important minerals. Yeah, other over the counter, you can go over that, but I still believe that magnesium is way on top of those things, but if it gets worse, you will need Advil or Tylenol and things like that. Important thing is, do not let the stress overcome you. Always try to manage your stress, because stress is a very big factor in initiation and propagation of your migraine headaches. So you have to control your sleep. If you're not sleeping enough, you will get a migraine attack. You will precipitate a migraine attack. So you have to control these factors. That make sure you sleep 7 to 8 hours every single night. You have to. If you're not able to sleep, talk to your doctor. That's really, really important. So, and a lot of other things, you will find out. And other very important home remedy, and it's been proven. I have put the links of all my research articles, and if you need more, I can provide you with more. But this is an abstract of a research paper, and you can see that ginger ginger is so easily available. I don't know about any part of the world where ginger is not available. Thank God. You know, God is so merciful. He gave us ginger. Ginger is so healthy that if there's something in your diet that I would recommend putting in is ginger. Good for heart, good for brain, good for muscles, good for every single thing. And here comes migraine research, that migraine pain, it is, it is like NSAIDs, like aspirin and paracetamol and a lot of similar pain meds that, and ginger is really, really good for migraine headaches. So what I recommend is, take ginger tea. I love ginger tea. Ginger tea is really easily available in the market. Ginger roots, if you can find, they are the key resource where you can help with your migraine headaches. So, what I have talked about today is, let's summarize it really briefly and quickly. Migraine headache, how it happens. It happens if you have stress, if you have any trigger factor, if you have aura, sinus symptoms that precede your migraine headache, you're going to get it. And there are a lot of hormones in the body that are disrupted. A very important one of them is serotonin. And that's why bananas are really good, because bananas help this hormone. Stress is very important to get rid of, because otherwise this hormone is affected, and then you get headache, you get migraine headache. Inheritance I talked about, role of magnesium I discussed, role of ginger, almond milk. Multivitamins. Why multivitamins? Because you get a lot of minerals, a lot of vitamins, a lot, and including magnesium, especially if you have heart problems or low blood pressure, and coma history, or any brain issues history, or breathing problem, where you cannot take magnesium supplements, the heavy dose supplements. Just take multivitamins. Multivitamins have approximately up to 20% of magnesium also in there. So that's another safe route that you can take. Please like, subscribe, and share this video to create awareness. My purpose of this video is to create awareness and to help the people, so that they can avoid headaches and they can become really good participants in the real walk of life. And most importantly, I would be able to answer in the comment section. You can send me comments. I do try to help people all over the world through WhatsApp. So if you have any big issues, any big concerns, you can always reach me. First, I would recommend you talk to me on the email, and then if you are really really somebody who needs help, who needs some advice, or suggestions and things that could help your life, please send me an email, and then we will chat through the WhatsApp app or FaceTime. We can do some, video live talk. I try to help people all over the world just to help them live a better life. So please like, subscribe, and share, and add the comments, and then we can talk. So live happy, live long, and have a very happy new year. Bye bye.